Hi, my name is Kivini Gomez, and this is a interview with Dr. Ceballos for Health Politics class. We want to hear her expert opinion in regards generic versus brand, Obamacare, and how does the insurance affect our patients and chronic illnesses as well. Dr. Ceballos, what is your expert opinion between generic and brand?
Okay, so I was actually working in before and making the medications generic. So it's very important that people understand that generic medications actually is very effective, like a brand. So in order for a medication to be generic, it has to prove this 95 to 97% effective, like the brand. So it's actually in order for the FDA give the license to be generic, so they have to prove this. So the patients has to try the generic, and it's going to be the same effect of the brand. Some patients have difference. It depends, but it's good to take the generic first because it's actually less expensive for the patients.
Under your expert opinion, and I know you have graduated from Purdue University, under your expert opinion, how important is for the patients to take their medications?
So it's very important. I have a lot of patients with chronic disease like diabetes, hypertension, or HIV, because I have a lot of patients with HIV too. So it's very important because if the medication, they don't take the medication every day. So for HIV, the virus becomes resistant to the medication, so they won't be able to use the same medication every day. So it's better for the patient to take it all the time. And diabetes, if the blood glucose increase a lot, it's going to damage the kidneys, it's going to damage the heart, it's going to damage a lot of organs. So it's very important that they are consistent with the time, and it's more like it needs education. The patient has to know this. Every time they don't take the medication, they're affecting their own body.
Thank you for your expert opinion. Our next question should be, how do you think that Obamacare has affected your patients? What type of dilemma do they face in order to get their medications, or how do they what type of problems do they face in order for them to go ahead and seek treatment under this Obamacare?
So I hear about a lot of patients saying the Obamacare, yes, it's 3 times more expensive than what they used to pay. So a lot of my patients, they decide to pay the penalty because Obamacare is like $600, for example, and they only have to pay the $2,000 for not to have insurance. So it's better for the patients just to pay the penalty instead of pay the $600 because they don't have enough money. They only make like, I don't know, 2,000, 3,000 a month, and they have to pay house, food, and everything, all the bills. So it's not a lot of money. So the calculation for what they pay per month, I don't think is correct because they don't have enough money for the other things that they have to pay. So these patients are going to Mexico to get the medication, or sometimes they only fill the medication once every 3 months. So it's actually, I don't think it's been affecting my patients to actually be to have a good adherence of the medication because the Obamacare is very expensive payments every month.
Dr. Ceballos, what is your expert opinion on the future of the health industry and medication?
So the government has to change the Obamacare, or they have to have a more easy access to our patients to have their medication. So I don't agree of the patients they were in there. And the VA, they have to pay for medications. The copay has to be zero because these are people that actually went and worked for our country for so many years, and now they come back and they have to pay for medications. This is not right. And in order for the patients to have Obamacare, it has to be more easy, like easy access for them to be able to pay every month, and they can have the medications. I have patients with copays of $20. It's a lot of, if you have 10 medications, that would be $200. So you have to decrease the copays to zero or maybe $1. But this something has to be changed in order for my patients or all the population here to have access to healthcare.
Do you think that with health insurance, if we are able to go ahead and get a pay for fee service, do you think that that will help, or at least ease the access for medications to any patients, especially with chronic disease?
What kind of fee service you're
Pay
talking
for
about?
fees,
Uh,
like when they go ahead and just pay cash instead of waiting for the insurance to pay.
oh, well, no, because like I said, I treat a lot of HIV patients. So the bottle of one of my medication for my patients is like $3,000. So they don't have the money to pay $3,000, and it's only 1 month. If these patients don't pay like a month supply, after like 6 months, they're gonna go in the hospital and be very sick and probably die. So it's some medication that are not available in generic yet, and there's good medication for them, but so because it's no, they have to find a way to find, they can pay some money, but the health insurance is better for these patients because it's like prevention. You want to prevent the disease before we have the disease, because it's going to be so much expensive for healthcare. So we have a lot of patients in PrEP. There's like a medication to prevent HIV, but it's sometimes very hard for the government to make them to pay for. Why is so hard if this is gonna decrease the high cost of the HAVA patients with HIV? So it's just like it needs to be a change in healthcare in order for my patients to be able to get their medications and prevent disease, and maybe like prevent more hospitalization. So every time they go to the hospital, they can increase more and more the money that is going from the government to the hospital in order for them to get better. So it's just like it has to be a arrangement in the healthcare industry.
Oh, thank you, Dr. Ceballos, for your expert opinion. I do appreciate it, and thank you for your time.
No problem.